Welcome to the checkup. I'm Aurora Aguilar, editor of Modern Healthcare. In June, Henry Ford Health System became the first major system in Michigan to mandate the COVID vaccine for all 33,000 of its employees and contractors. That led to a lawsuit from about 50 employees, but that lawsuit was later withdrawn. In the end, only 400 of Henry Ford's workers resigned or were terminated by the mandate. By October, the system was experiencing a 99% compliance rate. But like other systems and hospitals in the country, the vaccine mandate isn't the only challenge in dealing with labor issues. Henry Ford, like many others, is facing significant shortages exacerbated by burnout and fatigue. According to recent data compiled by the American Hospital Association, nursing staff demands at hospitals increased by 245% from September 2020 to December 2020 in just those 4 months. Here to talk to us about the innovative ways in which Henry Ford is dealing with labor shortages is its president and CEO, Wright Lassiter III. Welcome to the checkup.
It's great to be with you. Thanks for having me.
Thank you for joining us. So in September, I believe, or fall of last year, you announced that you were going to be doing something pretty innovative to try and deal with the labor shortage problem. And you've recently talked about steps towards making that happen. Can you talk a little bit about what that is and what you're doing to be able to address the labor shortage within Henry Ford?
Well, again, thanks for having me. And in terms of labor shortage, there's no silver bullet. And so I think that organizations like Henry Ford and many of our colleagues around the country are trying multiple strategies. The one specific strategy that you're referencing is sort of one arrow in our quiver, and it is looking at bringing nurses in internationally. So back in the 1980s and 2000s, Henry was pretty successful with his international strategy of attracting nurses from other countries that had similar skills to the skills of U.S. Nurses, and had the ability to overcome any language barriers to ensure we had adequate communication with our patients. And so we are reactivating that strategy by going specifically to the Philippines. And our goal is to bring several hundred nurses into Henry Ford's work environment during 2022. Our first goal is to bring about 100 in by Q2 of this year. So that process is complicated because you have to deal with the immigration process, and you have to make sure you dot all your I's and cross all your T's and support those individuals with getting through that process, and then going through an extensive orientation process to ensure that they have the ability to function the way their staff do who are from the U.S. And so we're in good shape. As that process goes, we're targeting about 100 to come in the first wave by Q2. We filed all of our initial applications that relates to the immigration process, and I would say that because we border Canada, we have a fairly active process on a daily basis of ensuring that we support our team who may need our resources around immigration. We frankly have between 900 and 1,000 nurses on a day-to-day basis that come across the border from Canada. And so dealing with nurses from outside the United States is not new for us. And so we're excited that our HR and legal teams and our outside consultants are working with our contacts in the Philippines to get the process going. And again, once we get the first tranche of staff in by end of Q2, we'll work through that orientation process and then begin simultaneously working on a second tranche of team members to join us. And last thing I would just say is that the Philippine nurses who joined us in the 80s and 2000s, many of them have practiced for long periods of time with Henry Ford Health System. In the community of Southeast Michigan, we have a pretty strong and robust community of Philippine individuals. And so it is maybe somewhat easier for us than in other parts of the country because we have the advantage of history and precedent. We have the experience. We sort of know what mistakes we made in the past and how to overcome those. And then we have a welcome community here that will welcome those individuals to Southeast Michigan.
Not just welcome, but given what we know about the importance of clinicians, healthcare professionals being able to really identify and understand the communities that they serve, this could really be a very good thing for you quality wise as well. So what are you doing to make sure that quality and standards of care are adhered to and the same as any of the staff that you would have from the United States?
Well, so, I would say that part of what you're hitting on is cultural competence. And so that's a very important part of what all health systems focus on. At Henry Ford, in particular, we're extremely focused on ensuring that we can reduce health equity gaps. And part of that issue is ensuring you have cultural competence with the team members who do the work. So we will be very diligent around, one, ensuring that all of the standard orientation process that we have for our team members, that every one of our international nurses go through that standard orientation process. We also have some additional culturation processes that helps with familiarity with the surroundings, housing support and those kinds of things, which oftentimes don't think about or extend as much with folks who are from obviously the United States and from the area. And then we will also provide the kind of cultural competence support. We have pretty aggressive diversity, equity, inclusion training for our team members that are required for all individuals. And so we won't require anything new from them. We'll simply make sure that they have the time and the ability to go through all of that and understand expectations. And then finally, we go through extensive nursing orientation for all of our new clinicians to ensure that they can apply the skills they've amassed in their careers in our environment, because we do know that it's not just about having skills. It's about understanding processes and procedures. It's about understanding local culture, more norms and mores, and ensuring that you have a good support system. And then I would just say that, when you think about quality in this environment, one of the most important things to ensure that you have quality beyond sort of the basics, which is having qualified staff to do the work, is ensuring that those staff members have what they need to be their best self at work. And that's a pretty, probably more complicated process than it was maybe 2+ years ago pre-pandemic, when you now have folks, that have their tanks, frankly, are less full than they were in January of 2020 when this all began. And so we have implemented a host of employee support efforts to ensure that we can listen to our employees' needs and then respond. But one quick stat is that during the COVID pandemic, we've had a 600% increase in our team members requesting employee assistance support. And so we have more than doubled our resources around employee assistance. We have begun wellness rounds and sort of resilience rounds for our clinical staff to ensure that they have an ability to about issues, to blow off steam, to hopefully feel like they're not alone. And then we've also put in place a process where our team members within the Henry Ford electronic environment have an ability to draft their stories of what they're experiencing during this time and to share that with their colleagues. And what I've heard and what our team has heard is that that's been one of the most successful efforts that we launched during the COVID crisis, to allow our team members to share, to vent, to get to blow off steam, and to see that the community that is Henry Ford is still a very active community, and that alone or isolated because of the stressors that you're encountering with the tough tasks that our team members have had over the last 2+ years, that you're not alone, and that you can share that story with others.
How have these problems with staffing affected your growth and service line plans?
The short answer is when you're in the middle of a crisis, sometimes it's difficult to think about tomorrow, next week, next month, next quarter, next year with growth, because you have so many resources that are focusing on putting out the fire. And so I'd say first and foremost that we've had to redeploy people to deal with putting out the fire. As we sit today, we're more than 98% full in our general med surg areas, with our ICUs being more than 90% full. And so a lot of our support resources that might be focused at times on growth are really focusing on how do we help down the hatches and put the fire out. And so we've delayed some plans for expansion. I think what was also happened for our system and many around the country is that consumers have not had the same behaviors that they might have had pre-pandemic. There were periods of time where our systems where our elective activity was shut down, and so we didn't have the ability to expand some of the areas that we might have wanted to. Would also say that the staffing shortages are causing us to close some of our clinical activity. We're in better shape than we were, say, 90 days ago, 120 days ago, but we still have about 75 to 80 beds closed. And so when you have beds that are closed and you also have high COVID volume, it doesn't necessarily give you the slack to be able to say, well, let's spend some time on recruiting, a new X service line to sort of push more volume when you have capacity issues. So that has created some challenge, but in spite of that challenge, frankly, during this COVID crisis, we've opened two very large ambulatory multi-specialty centers in two different geographies in the state of Michigan. That are helping us focus there. We've opened, $175 million destination cancer center in the heart of Detroit in the middle of the pandemic, and we did that. We kept that investment going because we knew that people were still suffering from cancer, and they need answers. I would also say, Aurora, that in the midst of the pandemic, we opened two partner hospitals internationally. And so, my belief is that we clearly have to respond to the firefight, which has been COVID over the last couple of years, but there are ways to expand. So obviously we started partnerships in the Middle East, in Saudi Arabia and in India, and those partnerships began well before COVID. I would say that COVID certainly had an impact on slowing down the progress of those projects, but we were still able in February of 2020 and then in November of 2020 to open two partner hospitals. And so, my belief is that while you're fighting the fire, you still have an ability to expand service lines, to look at growth, and we're very focused on growth in ways that's responsive to the community's healthcare needs.
So speaking about taking on additional sort of worries and concerns and things that are going on, you are currently the AHA chair, which gives you sort of a bird's eye view of everything that's happening nationally. So how has that perspective informed your own system strategy, and how are you using what's going on within Henry Ford to make sure that your member hospitals are also making progress in addressing some of these staffing issues?
Yeah. Well, I would say, first and foremost, serving in 2022 as the chair of the AHA board is a great privilege that I'm pleased to do. And I think that what it does most significantly is give me an opportunity to hear from the industry on a consistent basis around their most critical challenges. I would say that serving as chair hasn't changed the strategy of Henry Ford in any significant way, but it certainly gives me the ability to see and hear across the industry what challenges they're facing, what creative solutions many of the AHA members are employing, and then to be able to bring some of those back to our organization. It also gives me the opportunity on a fairly regular basis to share Henry Ford stories, and so we are sharing the story about our Philippine nurse process with our colleagues on the AHA board, and obviously with the industry overall. As chair, I have the opportunity to go to board meetings across the country and to visit with healthcare leaders in the regions all across the United States. And so again, part of that time, one of the primary efforts there is to listen and to hear what needs might they have, and to make sure that the AHA board is representing the industry as well as possible as we advocate, for policy and financial support, et cetera, in Washington. But it's also to hear stories and to learn, is there something unique happening in a part of the country that we haven't heard about, and that we can then bring back, and I can say to our team, hey guys, I heard of something really interesting, happening in Texas or happening in Montana or happening in New England, then we ought to think about this. And here's a name of someone that let's reach out and get more data so we can understand how we might be able to utilize that. That's principally what the chair's role gives me an opportunity to do.
And lastly, what are 3 pieces of advice that you would give other providers as they look to try and make sure that they're dealing with all of the issues that their employees are going through, and also making sure that they're able to recruit and retain new talent?
Yeah, so my first piece of advice is the piece of advice, frankly, that I've given our senior team, and it is to not presume, and also to not beat yourself up with thinking you have to have all the answers. We're in the midst of a very tumultuous time that none of us have faced previously, and that our workforce has not faced previously. And so we should not presume that what we've done in the past will work today. So the first thing I would say is presume you don't have all the answers, and then don't beat yourself up when you come to that realization. The second thing I would say is that we've got to listen with sort of triple the resolve that we ever have in our careers. Very, very clear that our workforce is experiencing sort of meteoric shifts in their expectations, in their resilience, in some cases in their connection to the purpose of work that we do. And so we've got to listen very carefully to how can we structure, and in some cases restructure, our approach to supporting the work that they do that still provides the kind of meaning that it has historically. The thing I would say is that I think as an industry, we've got to do something that outside of healthcare maybe does better than we do sometimes, and that's try a lot and be willing to fail fast and try something else. And so, I think that this is not the time for us to study for long periods of time to find the perfect solution. It's time for us to try something that we think might have an impact. Let's put it in place. Let's see how it works. If it has the intended consequence, keep going, spread it further. If it doesn't have the intended outcome, stop doing it, acknowledge that it was a trial and an error, and try something else. So those are my 3 pieces of advice.
I like it. I like cautious risk. Wright Lassiter III is president and CEO of Henry Ford Health System based in Michigan. He was also named the 2021 Crain's Newsmaker of the Year by our sister publication, Crain's Detroit Business. Congratulations on that honor. And thank you so much for joining us. I'm Aurora Aguilar, and I appreciate you watching The Checkup.